Good afternoon, everyone. Welcome to our webinar looking at the role of parenting programming in advancing adolescent well-being. I'm delighted to have a very distinguished panel with us this afternoon, who I'll be introducing you to shortly. My name's Nicola Jones. I'm a research fellow at the Overseas Development Institute, and I'm the director of the Gender and Adolescence Global Evidence Program. So we're really delighted to have a focus today on parenting programming. There's been an upsurge in recent years on programming, working particularly with younger children, but increasingly with adolescents. It's on the older category of young people that we're going to focus today and hear about interventions in supporting parents in lower middle income contexts. And we think this is really vital in the current COVID context, given that parents are having to shoulder a myriad of new responsibilities with the closure of schools and increased economic pressures, mental health stresses, and so forth. So we think this is a really timely conversation, and we're looking forward to your audience feedback as well. So what I would like to do very briefly is to introduce you to the panel who we have joining us today. And I'd like to begin with, unfortunately, an apology from the State Minister of Youth from the Ministry of Women, Children and Youth Affairs in Ethiopia, the Honourable Mrs. Simon Wube Haile. Unfortunately, there is no internet connectivity in the country at the moment, but she has kindly sent through some remarks, which I'll relay during the panel today. We're also really delighted to have Dr. Wela Kanzamanza Claudine, who's the Executive Secretary of the National Commission for Children from the Rwandan Ministry of Gender and Family Promotion. Thank you so much for joining us. We also have Dr. Kim Miller, who's a Senior Advisor for Youth Prevention at the US Center for Disease Control and the lead for Families Matter. And she's been working for a number of decades on parenting programming. So also very pleased to have you with us today. Our next panelist is Dr. Eve Puffer, who's a professor of psychology and neuroscience and global health at the Duke University Global Health Institute. Thanks so much for joining, Eve. And also very happy to have with us Rachel Marcus, who's a senior research fellow together with me at ODI, and also part of the Align network. And Rachel will be presenting some of the work that we've done Engage, looking at parenting programs in low and middle income contexts. So before we get started, I would just like to provide you with a very brief overview for those who are not aware of the Gender and Adolescence Global Evidence Program. So this is a longitudinal research initiative in the Global South, started in 2015. It will go for 9 years. It's a DFID-funded initiative, and it's focused on finding out what works for which adolescent girls and boys in which contexts, with the broader aim of supporting adolescents to maximize their capabilities both now during the pivotal second decade of life, but also in the future as they transition into early adulthood. So just to situate the discussion that we'll be having today on parenting, the conceptual framework that underpins the work of GAGE is based on a capabilities approach where we're looking at a broad range of adolescent well-being outcomes, from education and learning through to bodily integrity and psychosocial well-being. And we're particularly interested in understanding which types of interventions at which levels, whether are focused on the individual right through to system strengthening work, have an impact in fast-tracking social change for young people. And as you can see in the middle of the framework, we have a particular focus on the roles that parents can play in that process. And in terms of the way we go about this, we have a mixed methods approach. So we're following 20,000 young people across 6 different countries in East Asia, South Asia, East Africa, South Asia, and the Middle East. And we complement that with participatory and qualitative research as well. So what I would like to do now is to turn over the floor to Rachel to provide an oversight of the evidence review that she and colleagues carried out looking at parenting programs in low and middle income contexts. And Rachel, it'd be great to hear from you in terms of the methodology, but also particularly on the range of impacts that it's had on adolescent well-being. So thanks, Rachel.
Thank you, Nicola. Good afternoon, good morning, good evening. Thank you very much, everybody, for joining us. So to give a brief overview of the review that we did, we looked at 42 initiatives in 32 countries, and that was 58 studies overall. Most of them were very small. As you can see, almost 3/4 had under 500 participants, and they were enormously variable in length. Some were just one-day workshops. Others were a set of classes and events and home visits over the course of a year. But I'll say a little bit more about what we found about the most common approaches as we move through a few slides. So Nicola, if we could have the next one, please. Thanks, Nicola. So the review that I took with my colleagues, Jenny River and Krista Kruger, looked at programs in these 32 countries. As you can see, they're quite concentrated. And in particular, there were a few countries where most of the evidence came from. And in particular, we can see there was a real hub of evidence and innovation coming from South Africa, which was also particularly well documented. So I will draw on that quite a bit as I talk about the impacts. Thank you. Next slide, please. So in this presentation, I'm focusing really on what we found about the impacts of the programs on children's mental health and then subsequently violence on children. The slide shows some of the impacts we found, but I just wanted to talk a bit about what the programs were and how they achieved these impacts. So they had various objectives. They aimed to promote stronger family relationships as a foundation for reducing violence against adolescents and for improving mental health, and a small number of them also for reducing substance abuse. Some of the programs help parents talk with adolescents about sexual and reproductive health issues, from practical tips around pregnancy and contraception to also, more deeper issues around consent and negotiation in sexual relationships. And some of them also were simply around helping parents break down barriers to talking about these issues with their children, which are often taboo. A third set of programs we looked at had more specific aims, like helping parents support children managing internet addiction. And then a fourth small set had a particular focus on gender equality, changing parents' views on things like domestic workloads. So, the kinds of chores that their sons and daughters should be helping with and how much time they should be spending on those. And how did these programs work? Well, the vast majority, as I said, were short courses, usually for small groups of parents. It was really important that they brought people together. It gave parents an opportunity to share challenges with each other, to bond with one another. And we found that after the courses, in some cases, the support networks that formed through them were really helpful to parents in continuing to practice what they'd learned. Some of the workshops had activities for adolescents going alongside those for parents. Others brought in adolescents at the end, where they practiced role plays and skills, negotiation, for example, if a parent's trying to negotiate with their adolescent about going out or about doing their schoolwork, for example, or other issues that participants brought to the workshops. Others involve parents and adolescents all the way through. They really were quite a range of ways that they were organized. And a few programs also did home visits. So going to what we found then, as the slide shows, we'd seen that there were a large number of the programs reported positive impacts on mental health issues, and I think that shows that it's that they're set on the right path. That we know that adolescent mental health is really important as a foundation for adult mental health, so that when adolescents grow up, and become adults for themselves as parents, in their own relationships, in their work, but also it's extremely important in its own right for now, and that's increasingly recognized. And I think that's one of the reasons that we're seeing more of these programs starting to focus more and more on adolescent well-being. It's also, I wanted to note, and it's not on the slide, that around about a quarter of the programs measured at parents' mental health as well, and these programs found that they contributed to a stronger sense of social support among the parents and caregivers who took part. That was largely where they were group sessions that carried on over a number of weeks or months. And 6 studies did more clinical assessments of impacts on parents' mental health, and half of these found positive impacts. So, while they're not all finding a positive impact on every single indicator, in the main, they're certainly showing positive impacts. So, Nicola, if we could move to the next slide around impacts on violence against adolescents. Again, overall, we found that these programs were reasonably successful. They were very successful at changing parents' attitudes. You can see that it's actually only quite a small number that measured changes in attitudes, but out of a much larger set of programs that actually tried to change parents' use of violence. Parents had a very positive sense of how their own behavior had changed. In 10 out of 12 programs, they thought that they had reduced either hitting their children or shouting at them or punished them harshly in some way. But as you can see, adolescents didn't always considered that their parents had changed so much. And I think that maybe indicates that parents maybe had aspirations and intentions to change their behavior, which they weren't always able to live up to, but they were making steps in that direction. And the parents who took part, some of the qualitative studies showed us that they really appreciated learning that the harm that violence can cause, and practicing new skills, and gaining a better understanding of children's rights and responsibilities. And in some of the contexts in which these studies took place, children's rights had been quite a controversial issue. People had been feeling that the whole discourse and promotion of children's rights left them with a lack of clear tools and guidance on how they should be parenting their children. And so they found these workshops really useful to understand what their role as parents was, that they still had the right, as one parent put it, to be a parent. So as one mother in South Africa said, CHAMP, which was the name of the program, help by teaching us parents how far children's rights go and how far parents' rights go. So we were able to have a proper discussion with our children, and there was good communication, and we felt like real parents. The child was able to realize that she or he is still a child and this is a parent. And so in terms of what also made a difference with these programs, I've mentioned the fact that there were group classes which helped build a social support network. And some of these also followed up with buddies, so people who would visit program participants from time to time, which helped in 2 ways, both providing support but also reinforcing the learning that parents had gained through the programs, and reminding them that they were part of a community of people with similar aims and intentions. And again, from South Africa, some of the participants mentioned things like, they felt they made real friends. If they were in trouble, they could go and visit one of the other people who'd taken part in the course and, borrow some tea or sugar from them, or just have a chat and gain some social support. Another thing that made an important difference was undertaking formative research first and framing programs so that they were really carefully framed within the cultural context. And I think Eve can talk more about this, because one of the programs that we in fact looked at in this review is one that Eve had evaluated working with refugees in northern Thailand, and that had a very strong focus on making sure it was carefully attuned to the cultural context. And then one other final thing that made a difference was building in some additional program elements too. So they weren't only about parenting. In some of the successful programs, there was an emphasis, for example, on financial planning and budgeting. And where parents perhaps felt initially that parenting was not the biggest of their problems, or their relationship with their children or their children's behavior was okay, thank you. They didn't really need this. Building in some other components such as around financial management and budgeting, microfinance, was a way that hooked in parents, who then also realized that there was value in the whole program as well. So I think I should stop there, Nicola, and let you ask the next question.
Thanks so much, Rachel, for setting the scene. I'm next going to turn to Eve to reflect on some of the work you've been doing at the intersection of parenting programs to tackle violence against children and mental health. But just before that, I have an announcement to make that if any of you have any questions, we would please encourage you, since there seems to be an issue with the chat box, to send them in via Twitter at #parenting, and the Gauge handle is Gauge_program. So apologies about that, but we very much look forward to your questions. And now over to you, Eve. Thanks. You're still on mute, Eve. Can you unmute yourself? Still.
Hi, everyone. I was attempting to share my screen at the same time, which I think interfered with that. It's wonderful to be here. Thank you so much for the invitation. Can you all see my screen right now?
Yes, it's loading.
Are you all able to see the screen with the slide on it?
Now it's disappeared. It's coming up now. It's good.
Okay, excellent. Let me know when you can see it.
Yes, that's working well, thanks.
Okay, excellent. Yes, it's wonderful to be here, and I thought I would just take a couple of minutes to talk about some of the work our team has been doing in this intersection between violence against children, parenting programs, and then how that relates to mental health. This is a visual we come back to a lot when we especially think about parenting programs and mental health in humanitarian contexts or post-conflict settings, to remind ourselves that both child and parent mental health are occurring in this larger context. And I know I am preaching to the choir here, but this is an orienting visual for us to make sure that our parenting programs don't focus too narrowly on parenting, but consider mental health and then all of the factors that are influencing that. And a simplified theory of change that we think about when we look at our outcomes is that we are, of course, doing family-based interventions. And either those are to improve family functioning that is currently poor, or to prevent, to strengthen family functioning to prevent worse outcomes. Family functioning includes, but is not limited to, reductions in violence against children. And then we know that that has a reciprocal relationship with child and caregiver mental health, with caregiver mental health influencing their behavior with their children, and then child mental health resulting from that, often in a cyclical fashion. So I wanted to talk about just 3 programs that our team has done. And before I was at Duke University, I was at the International Rescue Committee. And the first one I'll talk about that Rachel just mentioned was done in close collaboration with them. So I'll just talk about 1 minute on each of these 3 programs, and then, of course, welcome discussion and questions later on. So we did our first study that Rachel mentioned called the Happy Families Intervention Trial. It is a parenting and family skills intervention for Burmese migrant families who were living in Thailand. And the formative work that Rachel alluded to really guided the development and adaptation of the program. And I wanted to show this risk chain that emerged from what caregivers told us in the qualitative work, because it highlights this interaction. That poverty and lack of legal status was associated with parental stress, including alcohol use, which was associated in turn with family conflict and harsh parenting, and then resulting children's behavioral and emotional problems. And one of the specific parenting links that parents themselves made was that the excessive work hours and stress related to this context of poverty and lack of legal status led to less time with their children for things like monitoring and nurturing, which then they associated directly with behavioral and emotional problems. So this intervention that resulted after a lot of formative work was a 12-session program adapted from the Strengthening Families program. And you'll notice here, these are common familiar elements. These are for an intervention that included kids ages 8 to 12 and their parents coming to each session. And you'll notice, for example, components 2 and 3 are a bit unique in that they focus on alcohol and drugs, both with the kids and the caregivers, and managing caregiver stress very specifically. And we did find decreased harsh discipline in this, reported by caregivers, which is the point that Rachel made as well. Improved interaction quality, according to both reporters. And then for mental health, which was a secondary outcome, we found reductions in externalizing problems, and children reported more pro-social behavior. Caregivers reported better, fewer attention problems. And the point I'll make across all of these and most parenting programs is this is a non-clinical sample in terms of both family problems and mental health problems. And that's the case for many of these. And so a major question that I don't think we've answered in the field yet is, as these kids go into adolescence and into young adulthood, what are we seeing in terms of the mental health results from a prevention standpoint? And the second program is the READY Prevention Intervention. This was for older children and adolescents, and we tested this in Uhuru Bay, Kenya. This is also for all families to come completely together, and the core component was family communication. And we taught family communication skills with a lot of in-session practice across these 3 areas that were common family stressors and emerged in our formative work as particularly stressful to families in this environment. And of course, HIV prevention was a major part of this. But we specifically, before we got to HIV prevention, talked about emotional support and how family members can support their children, but also how caregivers can support one another, making that explicit mental health link. And we did this within the context of religious congregations, which we hypothesized to be supportive organizations that can continue support and change afterwards. Our primary communication outcomes were significant, moved in the correct direction in the trial. Baseline mental health scores did not show a lot of clinically significant symptoms reported in this population. And we hope to conduct a longitudinal trial that looks at the prevention effects again. And the last one I'll mention is Tuko Pamoja, also in Kenya. This developed from the READY project, which was completely prevention and non-clinical samples, to really focus on an in-home, individualized family therapy intervention for families already experiencing high levels of distress, who also had a child or adolescent in the home already struggling with emotional or behavioral concerns. And we trained lay providers to deliver this in-home family therapy that combined family systems, solution-focused, and cognitive behavioral approaches, all distilled for lay providers into discrete steps. But what I wanted to point out about this program is that we chose to make it components-based. So it has these modules you see listed here, and families and the lay counselors together can decide where they should focus their attention first. Almost all families do family relationship work, but they can also just decide to do caregiver mental health or child mental health brief modules either first, during, or after this family work, so that we can address both things simultaneously. And we did a very small pilot trial that will be out soon, where we did see these family level improvements in child maltreatment, alongside the child adolescent mental health and caregiver mental health symptoms. And in some cases, that was without actually delivering those modules, really highlighting the reciprocal relationship between family functioning and these mental health symptoms, sometimes when they're addressed directly and sometimes when they're not. So I will stop there. The other work that I've done has also been in Liberia with programs for younger children. And so I'm happy to talk about my thoughts on how some of that might translate to adolescence as well.
Fantastic. Thanks so much, Eve, for giving us some really fascinating snapshots of some very exciting programs. And that was exactly the question I wanted to open up now to the panel is what lessons are there from parenting programs focused on younger children, where there's been a lot more evidence generated in terms of then thinking about programming with the adolescent cohort. So it'd be great to get your thoughts, but also thoughts from anyone else on the panel.
Sure, I can start briefly and talk about that. In Liberia, we did a program called Parents Make the Difference. That was again with the IRC. And we found reductions in harsh punishment. And then we did some follow-up qualitative work and found that one of the mechanisms of change parents talked about was improvement in their own emotion regulation skills, improvements in couples relationships, and improvements even beyond that with their neighbors and other community members. And so a couple of questions arose from that we haven't measured yet. One is, how are parents using this and with other children in their home? How is that emotion regulation contributing to this overall peaceful home environment, which is how many parents said it? If we're having some of that spillover to other adolescents in the home as well, because many of these parents have multiple children. So that's one thing I think that we should be looking at a bit more.
Thank you, Eve. I don't know if anyone else would like to come in. Kim?
I'd love to comment. I'm not sure how evidence-based this is, but just on a practical level, I think it's very important that we make parents of older adolescents aware of the key role they can play in the lives of their children throughout the life course. I think many parents think that after their children reach their teenage years, they need them less, and they tend to feel that they're going to focus more on their peers and they don't need them. And I think it's really key that in programming, we make parents aware of the key role they play in the lives of their children as they're getting older and developing and transitioning to young adulthood. They have key developmental tasks that they need to perform, and it's really critical that parents are involved. I also think that it's important that we really respect parents, and when we bring them into parenting programs, we do it in a way that we convey, we're not there to fix you. You're not broken, but we're really there to support you and give you tools and give you information and build your skills so that you can parent your children and help them have healthy and safe outcomes.
Thank you. Some really critical points there. And I think particularly that point about respecting parents is very well taken. Rachel or Madam Executive Secretary, anything you'd like to add?
If I may, I think one area where programs focusing on parenting young children have really led is many of them have done very well in engaging fathers in the care of young children. And I think programs working with adolescents could learn from this. And I think the way that some of them have done it is to highlight the importance that fathers play in young children's development and how good it is for young children, for their fathers to be involved. And I think parents focusing on adolescents could perhaps learn from that and adapt some of that in the way that they frame the way that they're talking about the program. So I know some of them, and these are not necessarily the programs that we're talking about here today, but some of the initiatives were very focused on, I don't know, again, sort of fixing problems, but maybe a sort of more positive spin and an emphasis on the contributions that everyone has to make to adolescents' overall development would be quite a beneficial way of looking at it, and a way I think is important, learning from initiatives with younger children.
Okay, very interesting. Thank you, Rachel. And Madam Executive Secretary, you said you had a comment.
Thank you so much for the good presentation from Eve. I just want to say what we do in Rwanda to engage also the community as something to reduce, let me say, violence, and to be more engaged also in the mental health aspects. We have, she talked about Tuko Pamoja initiative. Here in Rwanda, we have which we called in Kinyarwanda umugoroba w'ababyeyi. It is a parenting evening where parents are gathering, and there we have discussion on positive parenting and discipline at the village level. So we have also at the district level, the social workforce, which there we have also psychologists and social workers who work closely with friends or families. They are volunteers at the village level, and men and
Not sure if we've lost connection. I think, unfortunately, we have lost connection with Rwanda. Apologies about that. Hopefully she'll be able to join again shortly. What I might do while we're waiting for the Executive Secretary to reconnect is to move to the next question, which was thinking about what some of the implications are for the current COVID context. And as I've mentioned, unfortunately, the State Minister from Ethiopia is not able to be present, but she has sent some thoughts that she had asked me to weave into the discussion. So I will briefly share those, and then it will be great to hear from the panel about any insights as well related to the current context and how we can take broader programming experiences and adapt them to this context. So the points that the State Minister wanted to highlight were very much related to the role of parenting programs in addressing child marriage and gender-based violence in the country. And there, particularly in parts of the country where arranged marriages are a key challenge, then there's a recognition by the ministry that parents can be either critical agents for change and overcoming conservative gender norms that prioritize early marriage and don't invest in early education, but they can also be perpetrators of child marriage. And so accordingly, the ministry in its national roadmap to end child marriage within the course of the Sustainable Development Goals, the Vision 2030, are very keen to be engaging with parents as key stakeholders throughout the process in order to eradicate the practice of child marriage. And so now in the context of COVID-19, because of the closure of schools and because many community stakeholders are working from home, unfortunately, the country is seeing a spike in child marriages in many parts of the country where there's a tradition of arranged marriage. And reporting mechanisms have been weakened as a result, particularly because of the absence of teachers and fellow students to support in the reporting chain. And so the ministry is working closely with a range of stakeholders to try and support parents to become more aware of the longer-term health, education, and economic effects that child marriage can have. But the minister was also very keen that we would be able to relay lessons from this discussion about good practices in other low and middle income contexts. So I will now turn back. I think our colleague from Rwanda has rejoined. Is that correct? And then I will turn back. Not yet. Okay. So perhaps while we're waiting for the so would you like to continue? You now have resumed connection. Would you like to continue with your discussion about the Rwandan context?
Yes, please. I'm very sorry. Can you hear me now?
Yes, we can. Thank you.
So I don't know where we are now.
I had just filled in the audience about some of the remarks that the Ethiopian state minister had shared related to the challenges parents are facing during the COVID context. So it'd be also good to be hearing in general about the work the Prof is doing in Rwanda, but also now in this current COVID-19 context. Would you like to go ahead?
Yes, thank you so much. I think what I have mentioned is to come back on what have been said by Dr. Eve, and I thank her for the good presentation. In Rwanda, the community is engaged, and we have a platform which gathering parents at the village level to discuss about different issues regarding children and of course teenagers for prevention measures, but also to fund responses and to follow up with the community. So it is a good platform, and it's helpful also to talk about sexual education health for the target group. We have also, in terms of mental health support, we have psychologists and social workers at the district level, where they work with volunteers based at the village level. They are called friends of families, and they really help to have their trend on child rights and child protection, and they help to identify family the most vulnerable families, the most vulnerable children, where we can have the big risk of abuse, of exploitation, and it's a good channel to have a quick information for engage different partners and for have a good way to handle issues through referral systems put in place. So it was my comment, but I think as we have a panel discussion, I will come back on all those points. Thank you.
Thank you so much for that, Madam Secretary. So it would be great to hear from you, but also from others on the panel about whether any of the parenting interventions that are happening in different low and middle income contexts are being adapted and implemented in any form in response to the multiple stresses that young people are experiencing during this COVID-19 pandemic. I'm not sure who would like to start off. Kim, go ahead, please.
Of course, it is a particular moment, but as we are doing now is through, we are working a lot with social media, with phones, and as I was saying, as we are working with we use more now phones. We have many meetings online, and those volunteers mentioned have also mobile phones, and we have a toll-free 711, which is used to handle children issues. So it works, and we have partners. We have the Rwanda investigation board, which has also a Department of Child Protection with a hotline 116, which we are closely working with them to give quick response in the community. So, but we have also other partners, but to come again on the COVID-19 context, we have made more efforts to use online channels, social media, etc., radio, and so and forth.
Okay, very interesting to hear about those virtual adaptations. Kim, I think you also wanted to make a point.
Sure. We've been having a lot of difficulty getting our programming out during COVID. We meet in groups of anywhere between 18 and 30 parents at one time, and due to a lot of restrictions, which I know are necessary, we're not able to meet. So what we're trying to do is share key messages with the families in the communities where we work. We're working in 14 countries in Africa and Haiti, and share key messages that parents have learned in the program, trying to stress the importance of positive parenting, supervising your children, trying to really communicate with them, and avoiding situations where frustrations arise and harsh punishment, things like that. We're also trying to supply all of our families with resources in the communities that are open and available. So in the event that they do need to reach out and get services, that they're aware of where to go and what services are available.
Very interesting. And that I think also resonates really well with the program that we're evaluating as part of GAGE in Jordan with Syrian refugees. And their UNICEF Jordan has a platform working together with a range of civil society organizations. And that was a way for them to be sending messages and short videos to parents inside the camps, which were otherwise very much cut off during the initial lockdowns during the pandemic. So interesting to see those similarities across contexts. Anything that Eve or Rachel want to add? Eve?
Sure. Just one thing we've been thinking about is how we could apply some of what we have been doing in humanitarian or low income country contexts to high income countries in here in the US, as well as we think about how to reach populations when we're unable to follow our standard formats. And there are just a couple of things that I think we have an opportunity to learn. One is we may find more and more use for lay providers of these programs. We've done that to different extents of US-based parenting programs, but I think it could push the envelope on how we work with organizations who are the closest to families to meet their other needs, like we do in, for example, refugee camp contexts, to train lay providers within those services to deliver these interventions alongside in a more routine way. And the second is, I've been thinking about some of the work we've done in religious congregations. As we move through the pandemic, people are re-engaging in certain social groups, regardless, not for a parenting program, but they're going back to their religious congregations. They're going back to potentially schools and networks there. And can we minimize the risk of participating in some of our programs by working with those organizations and those existing social groups to still reach people in person, especially in places where internet access, even in the US, is still poor, and do some hybrid models of virtual and in-person, but by not adding to the risk. And the last thing I think we can bring in is potentially pushing our parenting programs from being just out of the box, follow the manual no matter what or where you are, to actually integrating some of these pandemic-related stressors in our role plays and our discussions and how that's impacting parenting. So I'm hoping that we can take this horrible situation and push the envelope on some of those things, even in high-income countries.
Fantastic. Thanks, Eve. Rachel?
So one thing we haven't talked about at all really so far is mass media, but I just wanted to give an example from UNICEF in Nepal, which was anyway running a radio program focused on parenting, largely focused on early childhood, but going a bit more broadly too. And so what they have done during this pandemic is integrated some additional content around, recognizing the fact that, many families are all together at home in a small space, which they wouldn't necessarily have been before because people would have been out working much more, and additional stresses due to economic stress and increased likelihood of violence. So these programs anyway were focused on trying to help parents redistribute workloads and to reduce violence against children. So they brought a COVID lens into that as well to enable a greater focus on the situation that people are currently facing. It's an interactive radio show, so it's broadcast both on radio stations and also via Facebook, and that enables people then to have a dialogue about it, about what they've heard from the characters in the radio show, the situations they're facing, and to share thoughts and tips. So that's just another different type of example of an approach that may be relevant in some places.
Thanks very much, Rachel, for that good example. We've just had a question come in from the audience to our colleague from Rwanda, asking how can other countries take your learnings on board and also work with men to improve the engagement of fathers in adolescent lives. So are you able to give some thoughts on that? I think you're on.
Yeah, thank you for the good question. Just to add something, we have also a child protection response plan during COVID, and communication is the most important part. We have prepared messages to the child, to teenagers, to parents, and the community in general. And we use, as I was saying, different channels online, radio, TV, etc. So, and we have also I don't know how to call it, but we have micro in at the village level, who messages are giving regularly, not only to be protected to, to be careful as COVID is there, but also to protect children, as it was said, as it is for all of us. Children are at home, not at school. So we have prepared as National Commission for Children, Ministry of Gender and Family Promotion, many messages to parents to protect their children for being safe at home. I was talked about the mobile broadcasting vehicles at the village levels. So to come back on the question raised about maybe other countries can learn from Rwanda. I don't know, maybe you come again, dear Nicola.
Thank you. It was specifically about how can our fathers be more engaged through parenting programs, and whether there's any learning from interventions in Rwanda or any reflections about working with fathers specifically.
Thank you so much. I think the first thing is the political willing. As you know, our president, Paul Kagame, is promoting he for she. As you know, it is something important for the community. It's good to the boys as well the girls have to be equal. So it's a good message from which is guiding. But as I was saying, we have many partners. We have NGOs, we have UN agencies, which who are our and we are in collaboration with them, where some of NGOs are more engaged also to put men on board, and it's something very good initiated in the community. And I think it's it's a good example which is helpful.
Thank you so much, and very encouraging to hear that. I'm now going to move to Kim, and there's a question in for you asking what can organizations like the CDC do to spread messages on positive parenting during the times of crisis. So I wonder if you could reflect on the work you've done with Family Matters more broadly, and then specifically around COVID. Thank you.
Well, one of the things that we've been doing is working very closely with faith leaders in the communities that CDC serves and that are served through PEPFAR, the President's Emergency Plan for AIDS Relief, really working with faith leaders across the African continent to make them aware of different COVID-related issues, to share messages about COVID in their community with their parishioners, with their faith groups, but also with their families, and being aware of issues, being aware of different resources and services that are available, and making sure that often key people in the lives of parents in communities, like the faith leaders, are involved. We also work closely, obviously, with ministries of health and ministries of education. We work through our orphan and vulnerable children programs to really strengthen what we can do with related to parenting, particularly during COVID. And then we've also been working with specifically adolescent girls and young women through our DREAMS program. DREAMS stands for Determined, Resilient, Empowered, AIDS-Free, Mentored, and Safe. And it's programming that specifically targets adolescent girls and young women, and really addressing a lot of social inequities and a lot of HIV risk that is prevalent in these populations. So we're really trying to weave in our COVID messaging. We've got, I know that I shared some resources that could be shared more broadly, specifically related to COVID messages around parenting, but clearly we need to continue to support our communities during this very difficult, challenging, and kind of unknown time, you know, especially for us here in the US, as we're struggling to get our epidemic under control and not doing that very well.
So Kim, it would be great if you could talk a little bit more specifically about how the work that you've done with Families Matter, how that is working to tackle underlying gender norms. We've had a question from the audience asking about work to tackle gender norms, and also how programs are then culturally adapted across contexts to take that into account.
Sure. If I may, I'd like to just give a quick overview of Families Matter. It's a program, it's a violence prevention and HIV prevention program for parents and caregivers of adolescents ranging in age from 9 to 19. We have two programs so that they're more developmentally appropriate. But basically, the program gives parents, it does three things, maybe more than three things, but we raise their awareness about the risks their children face very early in the life course. And we also raise their awareness about the key role that they can and we hope that they will play in the lives of their children. Then we build positive parenting skills, specifically parental supervision, building a strong relationship with your child, and parental communication. And then we really focus on preparing parents, giving them the knowledge, comfort, skills, and confidence to talk with their children about often very difficult topics like sex and sexuality, HIV disclosure, physical, emotional, and sexual abuse in children. So we work with these parents over 7 sessions. Each session is about 3 hours, and we're currently delivering this programming in 14 countries, in Africa, in Haiti, and then in the United States. We continue to deliver this program, but it's called Parents Matter. And to date, we've reached over 1 million families with our programming, and how we address gender norms, I will share with you now. So we start with the delivery of the program. We have all of our programming is delivered by both a male and a female facilitator with equal roles and responsibilities. So we try to model that at all times. We also invite both the mother and the father, or the male or female caregiver, to participate in the programming. It's not restricted to just the mothers. When we talk about issues related to sex and sexuality, often we kind of move that all over to mom's responsibility, but we really try to engage both parents. Throughout the program, we model scenarios where both mothers and fathers take very active roles in parenting. Throughout the program, we raise awareness and discussion about gender inequities. We advocate the importance of girls going to school. We advocate the importance of career goals, not just family-oriented goals. We talk about the harmful impact of parent marriage. And then we have a lot of discussion about gender-based violence. It's really infused throughout the curriculum. And we try to elicit reflection on harmful gender norms and gender-based violence risks that children face, both as potential victims and as potential perpetrators. We try to contextualize pressure and risk within authentic situations children face, drawing on scenarios that are written by African youth. We model healthy relationships based on mutual respect and communication. And we really try to encourage parents and caregivers to challenge community norms that provide opportunities for GBV and gender inequities.
Thanks very much, Kim. I just wonder if from that you could pull out any of the key ingredients that you have found through your decades of work in specifically engaging fathers, any particular success stories there that you would like to highlight, given it seems to be a question we keep having coming in?
Sure. When we started Families Matter in Kenya, which was in, I think, the year 2001, we had a great deal of difficulty getting fathers to be involved. And I think we started out with about 2% of fathers participating in our programming. But over the years, we've really, it's sometimes just as simple as asking fathers. And really, I know that sounds sort of crazy, but it sometimes is just as simple that you take the time to ask fathers to engage them in discussions about what the programming is and encourage them to participate. Fathers are very, very willing to come, and you can also create different opportunities for them. In Zambia, we've done all male groups. In other countries, we've done groups where both the female and male caregiver from a family come together so that they're learning the different strategies and tools and skills together so that they can employ them in their home. So that's really what I would say.
Thank you, Kim. And a follow-up question to that for you, Eve, that's just come in, which is about, have you seen examples of being able to engage with fathers in refugee or disaster contexts, or is it seen as a lower order priority in those moments of crisis?
We have in the trial in Thailand, we did have some father engagement, and I think it is sometimes a lower priority in terms of having these, for example, excessive work hours that people were facing. But I think one of the very practical things to think about is when and where you hold these programs when people are under so much stress. So this program was carried out in the local community where there was very little legal risk to the participants or safety risk. We also served dinner, very simple dinners, but that sort of takes away one of these levels of barriers. But often we are trying to do business as usual and deliver these interventions during normal work hours for the staff that are engaging in them. And I think that really limits, especially in more urban places. Like in urban Liberia, we had much less father participation than in rural Liberia for the Parents Make the Difference program, where in the rural area, labor is much more casual. And so they were more available on a regular basis. And I think some of the particular strategies we've seen there and in Kenya, as well as engaging male leaders in terms of recruiting and publicizing the program. And also in these very difficult contexts, being very clear about the nature of the program and the learning that can happen there, and framing it as an educational opportunity in addition to other activities that might be seen as only female-oriented activities, like mothers groups, things that are only social in nature. And so we found that misconception about a program can also drive men not feeling like it's their place to participate.
Great, thank you for that, Eve. Rachel, I don't know whether you wanted to add anything to the question of fathers.
Sure, just one other example. So one program that we looked at in our review, the one that had the greatest success in engaging fathers was an HIV awareness program that worked in work sites. So it targeted fathers at their place of work, and they were given time off by their employer for these education sessions that were on HIV, both relevant to themselves, but also in terms of their communication with their children. And that was explicitly part of the program. And I mean, that seemed to work really well as a very different sort of model, but one, again, that might be applicable in a more urban context, particularly where there are more people in formal workplaces.
Great, thank you, Rachel. So now I'd like to... Go ahead.
One more thing. I just really want to say the importance. We found really great success with engaging faith leaders and helping engage the fathers. And that has, I mean, in some of our countries, we now have over 32% participation by males. So, and a real key to that has been engaging faith leaders and helping them recognize the importance of males being involved in our parenting activities. Sorry to interrupt. Thank you.
No, very good emphasis. So the question I'd like to move us to now is to reflect on what sort of information and evidence do national policymakers and program designers need to really deliver effective but also context-appropriate parenting programs. So I don't know whether we want to start with the Rwandan case, whether you have reflections on what kind of data and evidence can support your role within the government to think about strengthening parenting programs. Madam Secretary. I don't know if you caught the question. You're on mute.
Excuse me. You can hear me now?
Yes, thank you.
Yeah. Is about Rwanda having data?
Yes, so what kind of information, what kind of evidence helps you within government to strengthen or take these types of parenting programs to scale and ensure they're effective to the specific Rwandan context?
Okay. We are basing on a survey made on the violence against children and youth, made in 2016-17, around there. And we are, based on the survey, it's clear that all forms of violence have been highlighted, And we have now a plan to handle the issue based on findings from the survey.
Okay, very interesting. So survey evidence looking at violence that children are experiencing.
We can share with you the reference if you want.
Great.
Thank you.
Thank you. I would like to take that question next about data and evidence to support effective programming. Eve, I don't know whether you want to jump in next.
Sure. I think that's a question we've been wrestling with as well. I think one way we're trying to think towards that is this cost effectiveness analysis and trying to really strengthen our methods around that. So I'm working with the IRC now on our second trial of Parents Make the Difference, which is, of course, group sessions for parents, and we tried a version with home visits as well, for example, and doing a cost effectiveness analysis. So when we take that and when we had a conversation with policymakers at the close of the trial, we were able to talk on the practical level of how much it takes to reach how many families, and also looking at it from a rural and urban perspective. And I think the next step in that is to take the way that we are currently delivering programs, which is often through non-governmental organizations that come with extra layers of costs, and to really think about cost effectiveness based on how much was spent on the program, and then going ahead and thinking about scalable community-based implementation models that could cost a lot less. So those are the conversations that I'm hoping to have in the future as we gain more evidence about the programs I mentioned, of sort of taking them out of only being delivered through the NGO world in a more cost-effective way. But it is an interesting question to hear from policymakers as well, how they would like to hear that information, how you decide who needs to hear that information. Those are questions that I still have that I'd love to hear others' examples about as well.
Kim, I don't know whether you have something to reflect on, given Families Matters has moved across multiple country contexts. You're on mute. Kim, you're on mute, sorry.
Please repeat your question. It's getting very fuzzy here.
So what kinds of data or evidence have you found effective to shape national stakeholders' uptake or scale up of parenting programming?
Well, the parenting programming that we use via the U.S. government in our PEPFAR programming is usually evidence-based or evidence-informed. So we're really sharing evidence-based principles with governments and ministries to promote the program. Specifically, our DREAMS effort, the Determined, Resilient, Empowered, Age-Free, Mentored, and Safe, uses all evidence-based programming and shares data from the VAC surveys and from a number of other in-country surveys to help support what we're doing around parenting, what we're doing with the programming that we deliver to on the individual level to adolescent girls and boys. But what we have found in our programming is that it's when you're bringing evidence-based programs into countries, to low and middle income countries, it's really important to think about the practicality of what you're doing. If you've got sessions where you need to bring the child 14 times. You've got to think about how practical it is to get the child out of school, those kind of things. So how these evidence-based programs really translate on the ground and how they're delivered is often quite compromised, and something that I think we need to work together. Eve, I'm really looking forward to connecting with you after this, but really working together to understand how we really can deliver quality evidence-based programming in often very constrained and difficult situations, with fidelity and with rigor. And that's what we're really working with. That's something that I work particularly hard with our partners and with our counterparts in country and our through our different government agencies, to really stress the importance of fidelity and rigor and implementation of realistic programming that can be delivered to parents with fidelity. We are very fortunate that in our programming, we have very high retention and very high participation. And I think that's because we offer something that is very relevant and germane to parents who are parenting adolescents. And I think the more specific, the more we can specifically engage with governments and share what we're doing, why we're doing and how we're doing it in a very thoughtful way that will resonate with the people in their country. Every place that we implement our programming, we culturally adapt the program to that country, and we work with leadership in the country across many spheres of government, health, education. We involve parents, we involve youth, to really make sure that we've culturally adapted the program and that we're really adapting it to the drivers of HIV and pregnancy and other risks that adolescents face. I hope I've answered the question, even though I didn't quite hear it.
Thank you, Kim. You did. It was great. So just one final question in from the audience, and then we'll move to wrap up. So the question is, do we have good practice examples about programs which are gathering information directly from adolescents about what they want to see from parenting programs and about what they would see as positive and supportive parenting? Rachel, any examples from you?
That's a good question. Other than the programs that Eve and Kim have already spoken about, which were covered in our review, that wasn't something that came over very strongly in the studies we looked at. And some of the issues where there was qualitative research that was quoted alongside analysis of the impacts, it highlighted issues like adolescents wanting, or the things that they appreciated was around, a warm environment, better relationship with their parents, feeling safe from violence, feeling that they could bring up topics which perhaps, culturally were quite difficult for them to do so as a young person, that it was taboo to talk to a parent about or to an older person about. None of the programs that we looked at and really described how they got that feedback from parents, but that's also partly to do with the fact that we were looking at impact evaluations, which put quite a narrow lens on. They tell you a lot about what the programs did and to an extent how they did it, but much less around those formative setup issues. So I think I'll now hand back to some of the practitioners on this panel who I think can give a more informed view.
Thanks, Rachel. Eve?
Sure. For our READY program that was in religious congregations in Kenya, we did a lot of participatory work to start and involved youth. We did a pretty standard qualitative study with youth, and that was one of the places where youth really expressed a lot of conflict over economic decisions. So not being trusted with money, not being part of decisions about how or whether their school fees were going to be prioritized, being punished when they asked about school fees, for example. And so that prompted some of the content, and then we involved them in the intervention development workshops themselves, where we provided sort of a shell for the intervention and had adults and caregivers and youth come together to do things like plan the role plays. And we asked the youth to really show us what it's like for you in homes, show us a negative example, a positive example, what you would like to see, and then they work together with the adults to come up with those role plays. So that was one example of how we took what they said would be done and said in a home from their perspective and tried to explicitly integrate it into the curriculum.
Okay, very interesting. And I think that resonates with some of the work we've also been doing in Engage, where we have been asking young people about the type of support that they want from their parents through a range of interactive tools. I mean, I think one of the things that's been fascinating for us during the COVID-19 virtual research we've been doing is that while some young people have felt they haven't been getting the necessary support from parents, others have said that actually lockdown has been, there's been a silver lining and that they've had time to discuss, particularly with fathers who are at home more. And we've heard that particularly from young people with disabilities, that they're seeing that their families are, in some cases at least, having the time and the space to sit down and listen more to their adolescent children. So, I think that's certainly something to continue to pay attention to as the pandemic evolves. I'm very aware of time. So what I would like to do now is just to give everyone on the panel an opportunity to finish up with a key takeaway message that they'd like to leave the audience with. And then just to let you know that a video of the discussion today will be online shortly on the Gage website, and we'll let you know when that is ready. So perhaps going to you first, Kim, just with your final thought.
Sure. I think just very much related to last points that were being discussed, it's really critical to engage youth in our programming and to really check back with the youth after their parents have gone through the programming and really hear their take on it. We go into communities and we meet with young people after their parents have completed Families Matter, and just listening to them about the things that have changed in their home and in their lives really helps us understand the impact of our programming. It really helps us fine-tune our programming. So my takeaway is always be talking to the young people right from the start when you're adapting your program, talking with them about how you plan to implement and recruit families, and talk with them after the programming has been delivered to really hear from them. We just have so much to learn from them. And that's really what I do, and try to build it back into the program and continue to strengthen the programming that we're delivering.
Thanks so much for that, Kim. And now over to you, Madam Secretary.
Thank you so much. Political willing commitment, as it's helpful for the engagement of the community. And the responsibility of children also under the community. The child engagement at earlier age, I think it was also mentioned by Dr. Miller. It's important to engage earlier our children, our youth, as the key population, as who will have to take a lead after us. So I think it's also something to focus on the new generation, to be part really of the community we want. Thank you.
Thank you so much. So some key points there about political will and commitment, engaging with communities, and also engaging with children in age-appropriate ways with these types of interventions. Thank you. Rachel?
Thank you. I wanted to make a point about follow-up and refresher support. I mean, as somebody who's taken part in a parenting program myself, I found that after I finished the course, the fact that the tutor would check in, by email or WhatsApp a couple of times a year to see, how we were doing, whether we were able to put things into place, made a big difference in terms of making me remember the things I'd learned and continue to implement them. And in our review, we didn't find that much evidence of whether there were follow-up mechanisms in place, which could be as simple, as I said, as a text, or it could be a community volunteer, having a chat and, finding out how things were going and if people were still able to put things into place. So my takeaway really would be that from what I've seen, it would seem that there's perhaps a bit of a gap in terms of follow-up support, and secondly, in documentation of that support and what kind of difference it makes. So I'd put a plea for that. Thank you.
Great, some very good possible low-cost techniques there. Thank you. And a final word from you, please, Eve.
Sure. Being on this panel and having done mostly much of my work with younger children has really pushed me to think about how this work can apply to adolescents, as well as what new work we need to do. And so I think a couple of takeaways for me in this process have been that we need to figure out how to do research on the longitudinal impacts on adolescents of what we're already doing in ethical ways. And second, that maybe we should find ways to focus on core family processes that will span children of all the age ranges in the home, instead of just very narrow age ranges that we would like to focus on, while not losing our developmentally specific focus where that is needed. And then the third thing is sustainability and scalability. I love the ideas that have come out in this panel around this, about working with faith leaders, as Kim was talking about, and those sorts of issues, especially as we are trying to engage with adolescents and the specific social environments where they are, and creating spaces where parents and adolescents can come together to work on these things. So those are directions that I hope to see our research moving as well.
Fantastic. Thanks so much, Eve. So this now leaves me just to thank the panel very much indeed for your time and for a very stimulating discussion. Also a big thank you to those who have been following online, also for some very thought-provoking questions. We hope that we can continue to engage with you around these going forward. And so I'd just like to take away a couple of take-home messages as we close. So it seems that there was really a strong emphasis on the need for creative mixed methods, data and evidence to support programming, including, very importantly, qualitative and participatory research with young people, but also large-scale surveys, particularly those with a longitudinal design, and importance of cost-effectiveness data. And then I think we also heard some really exciting adaptations that happen in real time of parenting programs, including the use of virtual and online platforms, mass media to get messages out, but also pivoting towards greater use of lay persons in sharing these messages and mentoring to parents. And a really strong emphasis on engaging with community leaders and with religious leaders as well. So I would urge you to read more on the GAGE website, the evidence review that Rachel led on, and also to check back in a few days for the video recording. So thank you all very much, and we look forward to staying in touch. Good afternoon, everyone.
Thank you so much.
Thank you all. Thank you.